Welcome back to the Voice of Chennai. This is an episode entirely dedicated to your health. Today we are focusing on digestive disorders. Dr. J.S. Rajkumar, chairman of Lifeline Hospital. Doctors never usually do this, but then Dr. Rajkumar, we'll forgive him. He came out of an operation theatre. He's on our way, pretty close to our office, but we've got him on the phone line. We've also got Shubha, our first caller. Good evening, Shubha. What's your question?
Yeah, I just want to get to know about the cholesterol and what kind of food can be preferred for a person who's aged more than 60.
All right, doctor, if I heard that correctly, the ideal diet for a person above 60.
Right. It's a good question, but it's a bit of a generic question, you know. I would answer it by saying it would depend more upon the patient himself or herself. For example, a 60-year-old or a 65-year-old without diabetes, without blood pressure, without a fatty liver, without a metabolic syndrome, that's quite unlikely. They are like that. It's like almost a normal diet. However, the same person was a diabetic and a hypertensive, then obviously the sugar and salt restriction in their diet because of their diabetes and hypertension would automatically hold good. So, to cut a long story short, it would specifically depend upon what we call in medicine the comorbid conditions of an individual patient. Namely, what are the various things they're having? The patient could still just be having a high uric acid. In that case, they should avoid too much of a protein because they might get recurrent attacks of gout, of gouty arthritis, etc.
How much protein can a person have? I mean, forget above 60, but a normal, for a healthy diet, how much protein can you have? Because a lot of people say that excess protein can actually damage the kidneys.
That is right. Excess protein, especially if you have a tendency to kidney damage, for example, a diabetic with kidney damage, what we call diabetic nephropathy, or a hypertensive with a kidney damage, hypertensive nephropathy, if they load too much of protein, they can land up with problems. But for the average person, 75 grams to 100 grams is good for a nice, healthy diet.
All right. 75 to 100 grams, not too much protein, remember that. Mano from Vilivakam. Hi, Mano. Welcome to the show. What's your question?
Oh, sure.
Go ahead, Mano.
Yeah, this is regarding triglycerides.
Yes.
Right now it is 390.
390.
And I'm on medication.
Okay, are you on statins? Are you on drugs for high cholesterol?
Yeah, maybe for 1 month, for the past 1 month.
Okay.
390 is very high, Sanjay. It's what you'd expect from somebody living next to Willy Wonka's chocolate factory. It's pretty high.
No, but Doctor, 390 plus triglycerides, shouldn't it be less than, it should be less than 200?
It used to be earlier we used to say less than 200 and 250. Now, the lower the triglyceride and cholesterol, the better. If it's less than 150, it's even better. So I think 390 is a really, really high triglyceride. There are very good drugs available for high triglyceride as well. You know, the Lipitor group of drugs, not specifically statins. If cholesterol and triglycerides are high, then statins, so there are specific statins are the drug of choice. But you have the gemfibrozil, the Caritor, Lipitor group of drugs, which will bring down the triglyceride quite well. I'm sure this person is suffering from a familial triglyceridemia. He seems young. I think it will be running in his family, and it can be kept down by the judicious use of good drugs, like one of which is gemfibrozil.
All right, we've got Deepak from Egmore. Yes, Deepak.
Yeah, good evening.
Good evening.
I'd like to know how to calculate the body mass index, that is BMI.
Yes, doctor.
Here we go.
I think even recently the health ministry has actually sort of tweaked that diagnostic cutoff to 23. If you can tell our viewers, how is this actually calculated? What is body mass index?
Okay, body mass index is nothing but a specific statistical package that evaluates your height-weight ratio. What you need to do is take your weight in kilograms. So supposing you're 100 kilograms, you put 100 on top as a numerator, and for the denominator, you take height in meters. For example, if you're 165 centimeters, 1.65, and take that squared, so 1.65 whole squared. So weight in kilograms divided by height in meters, the whole squared, will give you a number which will usually be between 20 and 50, 60, 70. So this is how you calculate it. And if your BMI is more than 3, then you're running into your overweight. And if your BMI is above 30, then you're obese.
All right. I think that signal, again, I think doctor is probably crossing a place where there's no signal. Hopefully, yes.
I think you're complex and I'm running up, so hopefully my BMI will be lower by the time I get up there.
All right. The doctor actually staying fit, running up. That's what happens when you come late, when the doctor is having to, in fact, catch those breaths there. We've got Vijay next on the phone line. Good evening, Vijay. What's your question?
Good evening. I would like to know whether what is the reason for fatty liver, and whether it has any connection with hypothyroidism, and what are the treatment available?
All right. If we can give the doctor a few seconds to actually sit down. He's come running in. I know he's extremely fit as a fiddle, but the doctor is just getting mic'd up here, so we'll give him those few seconds. Vijay, if you can also repeat your question, please. The doctor has just arrived. Vijay?
I would like to know,
yes,
what is the cause for fatty liver, whether they are related for hypothyroidism,
okay,
and what are the treatment available?
All right, doctor, non-alcoholic fatty liver disorder, and what is the treatment available?
Right, it's one of the commonest disorders in the world today, non-alcoholic fatty liver. There are many causes for it. One is early diabetes. 2 could just be high cholesterol or triglyceride running in the family. 3, it could just be abuse of food itself. Any of these could cause a non-alcoholic fatty liver. Now, earlier we used to think that chronic liver disease necessitating a liver transplant was only from hepatitis B virus or C virus or alcohol. But we now know that the #1 cause in the world is soon going to be NAFLD, which means it's a big worry. A chap with a fatty liver, if left with uncontrolled, without any dietary modification, uncontrolled lifestyle, it might well go on to a permanent loss of the liver, which could actually mean death.
So what is the treatment? Is there medication? What's the treatment for this?
Yeah, good question. #1, you look at any of the factors: alcohol, lifestyle, taking a lot of fat in the meals. Vegetarians, especially pure vegans, they take lots of ghee and they'll end up with a fatty liver. Non-vegetarians who go overboard, so both ends of the spectrum go into a fatty liver. People who are on statins and drugs that could cause the liver to accumulate fat. You correct all these.
But is that a sort of a contraindication there, because people have fatty livers usually because of high cholesterol, and then they take statins. So now you're saying statins could also cause liver damage. So it's a catch-22 situation.
It is a catch-22 situation. That is why we always give, whenever you put patients on statins, we tell them to keep checking their liver function
So
tests.
should somebody who has fatty liver stay away from statins?
Not necessarily stay away. As long as the liver function test, it's like this. He's running a risk of a heart attack if he doesn't take statins. With the newer statins, we look at the earlier statins, the plain statins. Now you have rosuvastatin, for example, which causes much less liver damage. So with each generation of statins, we're bringing in drugs that hit the liver less, but at the same time keep the cholesterol down.
But the easier option would be to exercise and eat right.
Absolutely, eat right, good exercise, and there are drugs like, say, ursodeoxycholic acid, non-specific liver health.
All right. Mr. Sinha joins us next from Nanganallur. Good evening, Mr. Sinha. What's your question?
My question is that suppose I am having a diabetes, and if I am living on a strict diet, if I am going on a strict diet, does it require me to go for a blood sugar test for every month? Because doctors say that take a blood test, only then I will give you your medicine. That is, suppose I am feeling that I am fine and I am on a strict diet, does it need to go for blood sugar level to test?
I think you should still check your blood sugar. What he's asking is, if I'm on a proper diet, do I need to check my blood sugar at all?
How often should one check without being called a hypochondriac? How often should one check blood sugar?
I think it depends upon each man's individual diabetic status. For some people, they have to have a kind of a poke and a CBG done every day. For other people who are kind of level diabetics, the diabetologists do them once in 2 weeks or once a month. I think, Mr. Sinha, if your diabetologist wants you to have test done frequently, it means probably he's having a brittle diabetes. Some people, we call it a brittle diabetes. One day it will be 290, next day it will be 72. In such people, Sanjay, it's not advisable to follow one shot. Just take 60 insulin in the morning, 60 in the evening. You might land up with dangerous hypoglycemia. So depending upon how fluctuant each man's individual diabetic curve and blood sugar runs, that's how often you must take.
All right, we have David from Manapakam. Before we go to David, in fact, there's an SMS here from Kasi who says, olive oil, is that okay? Is it okay to use olive oil instead? Does it help in any way, or is it just a marketing fad? Kasi sent an SMS.
Very good point, Kasi. May I just apologize publicly to Sanjay and to everyone?
No, that's fine. It's forgotten.
Olive oil is certainly better than, say, coconut oil or nallanai, etc.
It's a lesser evil, but it's an evil.
It's a lesser evil, but it's an evil. If you can, no oil is better any day than olive oil or cod liver oil.
Don't people need that little amount of, that certain amount of fat or oil?
Very, very tiny amount. Sanjay, every time you take some nuts, you get a lot of oil from that. You get oil from that.
Talking of nuts again, this is Kumar who sent us an email, in fact, to our feedback at ndtv-hindu.com saying, is walnut good to lower cholesterol? And with regard to almonds, should I actually soak it in water the previous night and peel off the skin and have it? This is I know a lot of people say that you should do this. Is it true?
Probably, I think my grandmother would have been able to answer that question more accurately. About the walnut, very big good thing that he brought it up.
How many walnuts?
Because at parties people ask me, if I take walnut, will it keep my cholesterol down? Taking walnut will not keep your cholesterol down.
It's not a statin.
It's not a statin. However, if your intake, this is how statistics are wrongly used by people, Sanjay. Taking your essential fatty acids and the needed fats through walnut is much better than taking it through French fries. It's much healthier. It contains much essential fatty acids. But it doesn't mean that taking walnuts will lower your cholesterol. If you took a guy who took walnuts versus somebody who didn't take walnuts at all, technically the chap who didn't take walnuts at all would actually have a lower triglyceride. But then you have to eat something to live. So we say take walnuts because it's a good source of vitamins, essential fatty acids, beta carotenoids, etc. And so we ask it.
David's calling in from Manapakam and waiting patiently on the line. David, welcome to the show. What's your question for Dr. Rajkumar?
Thank you. Dr. Rajkumar, good evening. My name is Dr. David. I am an eye specialist.
Okay. Good evening, Dr. David. Such a pleasure that you called in.
Yeah, no, there's a few things. Why are we not talking about indigenous products like, roots, herbs, leaves for cholesterol? That is one thing. Second thing is getting the people to know more about diet. There are so many fast foods that have opened up. In fact, there is a joke that there are 2 fast foods in front of a medical college. People eat there throughout the month and then they can be admitted in the ICU.
I hope I'm not being run by the hospital there.
No.
Good for business. No, actually, a good point. About the roots, he asked, there's a joke, the cartoon saying how, in 5000 BC, they said, take this root. And then tablets came along and injections came along and liver transplants. And now, technically, a lot of drugs that we prescribe, like probiotics, yogurt, etc., we say, take this root, it's good for you. So we're back where we started 5000 years ago. Undoubtedly, it is good. But most of us practicing doctors, certainly in allopathy, don't have the time or the wherewithal to break down the roots and say what comes of it. But I'm sure the Indian Medicine College is doing a lot about it. Second is, I agree with you that we should all, and I really appreciate NDTV Hindu for taking the initiative and going against fast foods.
We're running out of time. We've got probably last few callers. Bharati is calling in from KK Nagar. Hi Bharati, quickly, what's your question?
Hello, my question is places like North India where there is an iodine deficiency, it is good when government is ordered to incorporate iodine in the salt. But places like Tamil Nadu and Chennai where iodine is present everywhere normally, why is still we are insisting that salt it should contain iodine? And I feel that is the most reason for people to have hypothyroidism and hypothyroidism. Doctor, can you just give me an answer for this?
Sure.
Related to digestive disorders, I'm not sure. Okay.
Yeah, it's quite technically it's not digestive, but I can tell you that most of the salt in Tamil Nadu is also iodized. Wherever you see it, it's almost always iodized. That's why the incidence of thyroid goiter is actually coming down. So the government is doing what you're suggesting.
All right.
Okay?
There's another SMS which has come in from David again, another David here who wants to know how to get rid of indigestion and burping. Apparently, he's in an IT company. So he says after a heavy meal, he's tried various things like ginger and all that, and grandma's remedies, even like mint, lime and mint, he says, but it's not really working. Should he go on for medicines like Gelusil?
No, 2 simple suggestions which the public can use to their advantage, because nobody likes to burp and be made a fool of. Number 1, you burp because you swallow too much of air. So especially when you eat, all of us, we talk and eat. You should just eat with your lips closed and drink water with your lips closed without taking air in. It's a huge change. It's a cultural thing, most people are
Should you drink very quickly, since you've got a few seconds left on the show, should people drink water during meals?
Half a glass of water at meal time, no more than that. Okay. Start drinking about 1 hour after.
All right.
So these are simple ways of avoiding burping and feeling much better.
All right, and then the other thing is to come late to television studios and run up, at least that, but I'm sure you don't need that exercise because I know you're a fitness freak. But thank you so much, Doctor. A pleasure to have you as always on the show. Thank you very much for answering all the questions. That's all the time we have on Voice of Chennai. Stay tuned to this show, and coming up next is Ungal Sethi with Saudamani.